All right, so thank you for now. Korean authorities have shared a more clear forecast about our Omicron peak, and Shin Ye-eun is here to tell us more about that. Ye-eun, welcome.
Thanks for having me, Sunny.
Right, so when will Omicron peak here in the country, and how high will the tally rise, Ye-eun?
Well, Sunny, the Prime Minister on Friday said Omicron will most likely peak by mid-March and that daily infections could surpass 250,000. He added how authorities will address the situation.
The government will supplement the country's medical system so that it can contain the spread of Omicron effectively. In order for us to do that, we will first take some of the burden off the overloaded workers at medical clinics.
The Prime Minister said some 3,000 public workers will be dispatched to different regions along with 1,000 military personnel to support the medical system. Also, to ease the burden on our healthcare system, authorities are set to change quarantine rules for unvaccinated people who live with a COVID-19 patient. As of now, unvaccinated cohabitants are required to self-isolate for 7 days, but from March, they won't have to quarantine and instead will be monitored for 10 days. They're also asked to receive a single PCR test in the first 3 days. Then on the 7th day of their monitoring, they will be advised to test themselves with a home screening kit. But this testing recommendation will not be mandatory.
Right, I see. Meanwhile, Ye-eun, I hear mounting caseloads involving children are causing much concern here in the country.
That's right. The number of infections in those aged 18 and under has more than doubled compared to last week. As of Wednesday, this age group made up more than a quarter of new infections. And for young children under 10, they made up some 12% of the total cases. 3 of them died last week alone after only 2 deaths were reported among children in this age group over the past 2 years. Authorities said children and teens are especially vulnerable to COVID-19 because they haven't been vaccinated. That's why on Wednesday, the Ministry of Food and Drug Safety gave the green light to Pfizer's vaccine for children aged 5 to 11, and vaccinations are expected to kick off in late March or early April, and more details will be shared by health authorities next month. It remains unclear, though, if everyone in this age group will be eligible or just those with underlying conditions. However, some parents have voiced concerns over possible side effects and Korea's vaccination rate for 12-year-olds because currently they're the youngest of those eligible, but this rate hasn't even reached 10%. And what is known, though, is that this age group will receive smaller doses of the Pfizer vaccine, and clinical trials have shown them to be 90% effective in preventing COVID-19 with no severe reactions. Authorities are also considering dedicated emergency rooms that exclusively handle young children. As of now, there are some 95 centers nationwide that provide medical consultation and care for children and teens with COVID-19 that are recovering from home.
Right. On the testing front, Ye-eun, I hear we might have another option that does not require a nasal swab.
Right, so authorities are thinking of using another type of PCR test, but one that uses saliva. Instead of gathering a sample from deep inside your nasal cavity, this new saliva-based PCR test requires one to simply spit into a tube. As of now, it's actually yet to be approved by the Ministry of Food and Drug Safety, but once the ministry approves this, it will be another PCR testing option that can hopefully address some of the drawbacks of rapid antigen testing. And these kits could come especially handy for young children who may be afraid of nasal swabs. The Seoul Metropolitan Office of Education said it wants to trial this saliva-based PCR test and asked health authorities for a speedy approval. Also, to conserve testing resources, Health Minister Kon Dok-cheol on Thursday said the government may consider classifying people as COVID-19 positive based solely on rapid antigen test results rather than making them get a PCR test. Now, this is after they found that rapid antigen tests conducted by doctors had an accuracy rate of 90%.